Hi, I'm Lauren. I'm a Community Program Coordinator at Olympic Community of Health, and I train and provide technical assistance for Olympic Connect care coordination partners. Today, I will be introducing an update to the Connect to Coordinator workflow that we created as a means of closing the loop with referring providers. Closing the loop refers to the process of ensuring that a referral, communication, or follow-up action has been completed, acknowledged, and documented. This update's going to be going into effect in June. It will affect program leads and care coordinators and will only apply if a client has been referred by a provider who would like to be notified when that individual is connected to Olympic Connect. For example, if a provider in a clinic is working with a patient and they mention they're having a hard time paying for their electricity bill, that provider might fill out an Olympic Connect referral form for their patient. When the provider includes their contact information and requests a follow-up when their patient has been connected to Olympic Connect, you will see a new task to contact the referring provider when this client is assigned to you and your organization. In the next slide, I'm going to demonstrate what this will look like, so follow along with me and know that you can always reach out to us if you have questions or need further assistance. For this demonstration, I'm acting in the role of program lead or supervisor, who in this case is listed as Celeste. So I've reviewed the case and confirmed that this client is an appropriate match for my organization, so I need to reassign the case by clicking the Actions button in the blue case banner, Reassign Case, and then selecting the care coordinator from the drop-down menu. I want to be sure to uncheck the blue box next to Reassign any open tasks to the new assignee and hit Save. Then I can complete my review case task, and the last thing I need to do is reassign the contact referring provider task to the care coordinator who has been assigned the case. I do this by clicking the curly arrow next to Celeste's name in the contact referring provider task. I'll select the care coordinator that's been assigned the case from the drop-down menu and hit Save. When the care coordinator is ready to reach out to the referring provider to close the loop, they can click on the task and read the task summary / reason section, which will have all the information the provider included on the intake form. Once the care coordinator has reached out to the referring provider, they can complete the task and move on to the next step in the workflow. When connecting with your client's referring provider, be sure to only share information your client has authorized to share. If you're reaching out to the provider before you've contacted the client, it's okay to just confirm that the referral was received. If the referring provider wants more detail, it's best practice to get the okay from your client first and be sure to only share information the client has authorized to share. Being able to touch base with the person who referred your client to Olympic Connect and let them know the client is in good hands is part of what makes Olympic Connect stand out. I hope this demonstration was helpful. We're always here to support you, and we are so grateful for the work you do. Thanks for watching.